Hey everyone, it's Rebecca Taylor with Green City Dental. Today I want to talk to you guys about mouth breathing. Okay, really common, and once I teach you guys this, you will just look at every person differently. Okay, so mouth breathing is when we're using our mouth to breathe instead of our nose. Okay, and we see this in about 55% of the population. And especially in kids. So the reason why we're worried about this as dentists, and why you should be worried about this as a parent, is because the tongue position in the mouth actually dictates and helps with the growth and development of the face and the jaw. So if our tongue is down because we're breathing through our mouth and our lips are apart, the tongue is not up in the palate, which is stimulating proper growth. Okay, so we see that kids that have a mouth breathing habit, they actually have smaller jaws and their teeth come in more crooked, which means you get to pay more in orthodontic treatment later. Okay, so one of the things that you can do for your kid is go home and take a look at their lips at rest. Okay, if the lips are apart at rest, or if you go into their bedroom when they're sleeping at night and the lips are open, or they're doing any kind of like snoring or weird breathing, we know that they're breathing through their mouth. Okay, now there's different reasons as to why kids do this. Most of the time it actually is because it's a habit that's been formed. So this habit can be corrected with myofunctional therapy, Butanka breathing, or you just reminding your kid, close your lips. Okay, so a test that you can do with your child to determine whether it's actually a nasal obstruction and they physically can't breathe through the nose, or whether it's a habit, is during the day, go ahead and place a piece of tape on their lips. Okay, probably not duct tape, but they make some sensitive skin tape that you can get at the drugstore. Okay, so put the tape on their lips and have them breathe for a few minutes. Okay, if your child is like, I can't do it, that means that there's a nasal obstruction. Okay, that means that physically they cannot breathe through their nose. This really needs to be addressed as soon as possible, so that we can get their tongue up in the palate and help with that growth and development of the face. Okay, and there's many different ways that we can do this. And we can talk more about that in another video. The other thing that might happen when you put the tape on is that your child is fine and they can breathe for a couple of minutes through the nose. This is a habit, and this, again, like I said before, can be corrected with myofunctional therapy, Butanka breathing, and you reminding your child to close your lips. Okay, so I hope this helps. I hope that you guys go home and when you're at the grocery store, take a look at the kid next to you. Once you start noticing mouth breathing, you will see it everywhere. So we'll see you guys next week. I'll talk more about the health implications of mouth breathing and why it's really detrimental.